Hi friends, in this video we are going to be talking about a very simple strategy to crack the next FMG exam which is going to take place in January 2024. Now before I start off the discussion with the plan, I just want you to have a look at the slide appearing in front of you which categorically talks about the focus on your dreams. Please remember a simple fact. All of you wanted to wear that white coat. All of you wanted to have that steth around your neck. All of you wanted to take care of your patients in the best possible manner. But just remember a simple fact that your dreams are not your dreams only. They are the dreams of the people who have loved you for long. They have been the dreams of the people who have cared for you. And when I say that, needless to make a mention that it practically belongs to your family members also. तो आपने एक सिंपल चीज़ याद रखनी है कि जो आपके सपने होते हैं वो अपने नहीं होते, वो अपनों के भी होते हैं. दैट इंक्लूड्स योर well wishers, that includes your siblings, and most above all, that includes the dreams of your parents. So please do everything within your reach to realize your dreams at the earliest. Now, when I talk about the way to prepare for the exam, the very first fact is that in spite of having around 60 plus days, can we make it? And the answer is a big, vehement yes. So therefore, you have to have a belief in yourself. Please remember the fact that you cannot fix up what has taken place yesterday. But for sure, you can take the responsibility of what is going to come tomorrow. तो आपको सबसे पहली चीज़ याद रखनी है कि एग्ज़ाम क्रैकेबल है. हाँ जी, अभी भी क्रैकेबल है, लेकिन कैसे क्रैकेबल है उसके लिए आपको कुछ इंपॉर्टेंट चीज़ों का ध्यान रखना पड़ेगा. और जब हम उन इंपॉर्टेंट चीज़ों की बात करते हैं तो ऑफ कोर्स सबसे पहली चीज़ है कि हमने प्लानिंग कर ली, हमने मन बना लिया, वी ऑलरेडी हैड अ एम ऑफ क्लियरिंग द एग्जाम, वी नीड टू हैव एन एक्शन प्लान. Considering the time that we have on our platter, I have just divided the division of the different subjects into these days. Deliberately done in a manner wherein we have talked about the subjects in a prof-wise fashion, as well as keeping in mind the weightage which has been given to the different subjects. So if I look at this particular plan closely, I have given anatomy a good 3 days, I have given physiology a good 2 days, biochemistry 2 days, pathology 3 days, pharmacology 3 days, microbiology 2 days, forensic medicine 1 day, ENT and ophthalmology 1.5 days each, PSM 3 days, medicine, surgery 4 days each, pediatrics 2 days, obstetrics and gynecology 3 days, skin, anesthesia, radiodiagnosis, psychiatry and orthopedics 1 day. I shall be sharing that tentative schedule for the reference of all of you in a Telegram group as well. What I want you to understand is that if you collectively count all these days together, the total comes out to be 40 days. Now, why only 40 days? Why not more? Why not less? First fact is that this is the time, to my experience, which is required for reading the subject well. Now, presuming that you have had some basic idea about these subjects, I want you to utilize 2/3 of the time given to each subject for the purpose of revision of your theory, and 1/3 of the time to practice the MCQs of the respective subject. Please also remember that when I talk about 60 days, so I have given 40 days in total for the first reading, presuming that this happens to be a first reading for all those of you who are preparing for your exam. Of course, we are going to be in a far better position, but still those 40 days are going to be taking care of the first reading. The next 20 days for each of these subjects, just reduce the time by 50%. जो टाइम आपको अभी मिला है आपको उसका आधा कर लेना है अपनी अगली रिवीजन के लिए. And when you are going to be doing this, even starting off with today, which means a good 60 days, when we are having for the exam, you will at least have 2 more revisions. We understand that at times there are people who are going to be having a problem in covering the subjects when they are looking at the videos. So for taking care of that, we do have the presence of the live sessions under the mission program of Cerebellum. In case you belong to a category of a student who is not very comfortable looking at the lectures and who wants to have an interaction with the respective faculty, please do have a look at the mission videos. A lot of people did benefit from the live sessions which were done for the June-July session, and now there are going to be fresh sessions with added material with more relation with the questions which are being done now. So in case you wish to attend those live sessions, you're going to be most welcome. Otherwise, this particular schedule will ensure that 60 days you will be having at least 2 revisions. And when we talk about those revisions, we always have to keep in our mind that let's do this together. Of course, for any kind of an exam, there are certain basics that have to be adhered to. क्या होते हैं वो basics जो इनका आपको हमेशा ही ध्यान रखना है ताकि हम भूल ना जाएं. Just for the sake of that revision, we have to minimize our distractions. So the fundamental concept of minimizing your screen time, and when I talk about the screen time over here, I intend to refer to the non-academic screen time. So the best thing would be if your phone is going to be on, then it is going to buzz, and if it is going to buzz, it is going to take away your focus. So keep the phone on the airplane mode for the time when you are studying. So which means that you have to, rather counting than the number of hours, you have to make each minute, each hour count for your academics. The second happens to be regular practice of MCQs. You would have heard so many people clearing the exam and sharing with you that it is not only the theory which has helped them crack the exam, it is also the regular practice of the questions, and specifically Cerebellum Q Bank has got the kind of questions which are going to be a mixed bag, in the sense that there are going to be certain one-liner type of questions, which means straight information asked questions, and there are going to be questions which have got a clinical history, which is the pattern of the exam these days. Any kind of a test that you're going to be appearing in, any kind of a grand test, is going to be giving you a very good insight about the subjects which are your strength and the subjects which you are not so good at. When we talk about the subjects which you are good at, be having a solace in them that those are the ones in which you are likely to have a better score. For the subjects which happen to be gray areas, please pay more attention to them. Whenever we are going to be talking about the third thing, that's going to be whether we are talking about the concept of, as they say, the sun and the moon. So one of these happen to be the source of the light, and the other one happens to be just a reflector of light. But then again, whether somebody happens to be the source or somebody happens to be the reflector, the aim is to shine bright. What for you as a student that would mean is, whether you're creating the content by yourself, or whether looking at the notes which have been prepared by you, or you are having the printed notes by you, make sure that every line which has been written in the notes is being remembered by you as much as possible. The exams are a time when a lot of students are naturally likely to be stressed, and there are going to be lots and lots of stories floating around, no matter wherever you are, whether you are in India watching this video, whether you are still abroad. But there are going to be people who are telling you exam ऐसा आता है, exam वैसा आता है, ये mock test कर लो, इसके इतने questions, उतने इसके questions. Trust one source, right? And ignore all the naysayers, because naysayers are going to run away the day you are going to be having a good bright result in your hand. Not only we have to crack the exam, but we have to ensure that we crack with a super score. And when I say a super score, personally I would want each one of you watching this video to get a score of 200 plus. Remember, this is a threshold exam. There is no limit, there is no cutoff with respect to how many people can pass the exam. Of course, there has been certain times when the score has been better, the pass percentages have been better, perhaps because of the fact that people worked harder, or because of the fact the people were having more attuning of the questions. But as it happens, the moment there is a good result, the subsequent batch people have a tendency to become complacent. This is not a time for any of us to lose our focus, to become complacent, and therefore keeping the focus intact, we have to ensure that we have an action plan. We have to ensure that we have to follow the fundamentals of creating any exam, not only the screening exam, but all subsequent exams henceforth, right? And keeping that in mind, we must never ever forget what comes on the screen. That's a gentle reminder. You are far more stronger than what you think you are. It's all about thinking about success, about clearing your exam over here. Once you start believing in it, once you start acting on it, there's nothing which is going to be stopping you ever, ever and ever. As always, please do take very good care of your health, and all the very best wishes from my side. Till the time we catch up on the other side, taking up interviews of each one of you when you crack the exam with a super score. This is me signing off. Best wishes always.